Behind them is really three different areas of screening, and what we see in our practices is a little different from most. So in our audience today, we have people in general pediatric practice. In those settings, we really have low risk, regular well child care, full-term birth, maternal prenatal care, normal birth weight, normal growth, adequate financial resources, healthy parents, two-parent families, and without a family history of developmental problems. We've chosen the peds based on some things that we're going to talk to the panel about. But the other thing that's available to everyone attending this conference, both online and today, is we have the ages and stages, which is really designed for really that second group, the group of intermediate risk, in which perhaps there's a family who's had intermittent well child care, the maternal prenatal care has been intermittent, maybe there's prenatal tobacco exposure. Dr. Russell restrained himself today and didn't really talk about the alcohol and other drug-affected children who are at high risk. Children with feeding and growth problems, multiple caregivers such as foster care, stressed parent, a single parent family. And these are the parents and patients who we really need to do more of a screen and have a lower threshold for referral. The children who Ann Balzer will be addressing as our final speaker, and oftentimes referred within our clinic, are the really high-risk children who have very infrequent child care. So these are homeless families, families who the children have really no developmental advantages. There may be no maternal care, there may be no paternal care, premature birth, prenatal exposure to drugs and alcohol, low birth weight, genetic disorders, chronic illnesses, feeding and growth disorders, severe poverty, foster care, patients who come in under international adoption, even if you have to live 18 months or more in Malawi to adopt. Parental depression, and we have resources at Mandalay Bay in terms of maternal depression, but as Dr. Thurber was referring to earlier, we may have problems with the parents with mental illness or substance abuse as well, exposure to lead and toxins, teen parents referred to our public health program, and a family history of developmental problems. So I'd like to start with Dr. Bobrow, if we could pass him the microphone. Dr. Bobrow, you attended a conference in Los Angeles that helped, I think, guide you to introducing the peds into your practice. Could you talk a little bit about how that conference was for you and how you were able to introduce the peds into your practice? I know we're right in the process right now.
Yeah, the conference is called the EDSI, which stands for Early Developmental Screening Initiative, and it's a program put on by UCLA Developmental office in conjunction with the Cincinnati Children's Hospital. And for me, it's been really training wheels to get the program up rolling, because there are about a dozen clinics, mostly from Los Angeles County, which are all in the same boat. They're all starting developmental screening, and we all go through the same steps. And I had the benefit of having some colleagues who also have already implemented the screening at their offices in some cases very similar settings. So we meet regularly, have conference calls, and it's been a nice resource. And if anybody's interested in the following year's conference, I'd be willing to give the information.
Now you have put that into place. Have you had a meeting with all of the practitioners in your clinic? I know you have nurse practitioners, physician's assistants, you take care of mixed ACO families, the family practitioners. I know there's a reluctance because they weren't sure if there were resources available. And we're going to hear later from our navigators who are there to really help you in the clinic. So if someone is identified, signing up with CCS, getting to Tri-Counties, filling out all the forms, finding the address on the building, for those of you who had any difficulties. So how did you bring that about?
Well, yeah, that's a process. We've had a meeting with Dr. Nopar, who's the medical director of Tri-County Regional Center, and that was helpful in I guess bringing some muscle again into the room and showing the other providers that there are resources, that there is a place where they're going to go. But we're in a process of assembling information and making the web of information and resources understandable, because in our clinic, which is primary family practitioners, we have individuals who've been in practice for 15 years and still are learning where to send patients, where to send these kids. So it's a process that we're, digging into, and we've had regular meetings.
Thank you. If you pass the microphone to Dr. Lava. Could you go back one slide? There we go. This was developed by Dr. Bob Brown. We showed this at the very beginning about how complex it is at each visit. And this is really starting at that first inch, where the medical assistant, what do they need to assemble? Dr. Lava, who's with our Mandalay Bay Women and Children's Medical Group, has been a leader in disease registries and establishing a combined clinic with both women and children working together with obstetricians. And tell us a little bit about trying to implement all these things, reach out and read. We have Dr. Park here today, and dental varnish, and now you want me to do peds. And
can everybody hear me? Okay. I'm a little bit distracted from that light that's shining up on the ceiling, so let me know if you can't hear me well. Change really has become more the norm in our clinic, and tests of change has become more the norm in our clinic, mostly because we've been doing a number of different collaboratives, be it asthma or clinic redesign, and a number of other projects. And so I think it's not been as much of an issue to get people to engage in doing these projects. We do know that there are a lot of different projects that are necessary in the course of taking care of a pediatric patient. And so what I've chosen to do is make sure that not only one person shoulders the burden of a particular project, and so we actually will use the patient care team. So the patient care team involves not only the front office personnel, the provider, but the back office staff. So that's how we've kind of gotten people to engage.
thank you so much.
You're welcome.